Welcome to part 2. We're excited you're here to continue the conversation with us. Let's dive right in and pick up where we left off.
You can see it from the patient perspective, or you can see it from the provider perspective, which means the doctor and the medical staff. So let's look at it from a hybrid view, let's say. If you're a patient today and you call on a doctor, any doctor, but let's stay on the orthopedic field, what you do, you call and you want to make an appointment. You get the appointment based on maybe your insurance status, which is not great, but also you get it just based on when is the next available time slot. The staff that is taking the appointment and booking it for you is not trained to identify how urgent your case is, right? How long do they have to plan for the appointment? Then you go to the doctor's office. Often you are mismatched, so you see the wrong doctor. They refer you to somebody else. Or you arrive, they just have 5 minutes for your case. Then, the doctor comes in. We talked about it earlier, doesn't have all the information, has very little time. The appointment is frustrating. The treatment recommendation might not be aligned with your personal expectation. Let's say you are rather young, right? You are maybe athletic. You have different expectations for your procedure than someone who's maybe elderly, 85 years old, but has the same injury as you, right? So you need to adjust the treatment based on the expectations of the patient. And all of these things right now don't really work as smoothly as they could. So one thing we do is we make sure that patients are matched with the right specialist at the right time. So based on the urgency of your case, we give you an appointment sooner rather than later. If you need a surgery, we need to give you an appointment quickly, because if we treat you within 3 days of your injury, for example, we can achieve a really good health outcome. If we treat you in 3 weeks when the next appointment would have been available, then the doctor in many cases has to say, oh, I'm sorry, if you had come in 3 weeks ago, I could have helped you really well, but now the surgery will be far more complicated and the outcome might not be as good, which is really frustrating for the patient and really frustrating for the doctor as well, right? If you come in and you need surgery, we probably need to plan 20 minutes of appointment booking time rather than 5 minutes if you have something that can be solved just with physiotherapy, where you go in, the doctor examines you in a couple of minutes, prescribes physiotherapy, you're out the door. And so by asking questions at the beginning, 5 to 10 questions before you book the appointment, we can say when your appointment should be, who the specialist should be that looks at your case, and how long the appointment should be scheduled for. That's one example for inefficiency that we solve.
That's really interesting. From a data perspective, how did you manage to integrate the data for those assumptions in a way that is efficient but also secure?
Yeah, this is a big topic in healthcare, and there are many data silos. We have the advantage of we start at the very beginning when there is no information and we capture that information. This is why we started with the anamnesis, by the way. When we talk about Ortho Copilot and we talk about a copilot for a physician, we're talking about something that goes from the very beginning, the anamnesis, all the way to the treatment is completed. But the reason we started with the anamnesis is because that's where the first round of information is being generated. So we're there sort of at the very beginning. At some point, we will have to build a practice information system that is specific to orthopedic doctors, which means that we are going to basically be the competitors of every information system that caters to doctors. But we have the competitive advantage of being extremely domain specific. Practice information systems today are very generic. So basically, no matter whether you are a dermatologist or an orthopedic doctor or a GP, general practitioner, you basically use the same piece of software, but it's not tailored necessarily to your needs. And if we want to build solutions that really leverage technology, especially AI, we need to build tailored solutions for, specific medical areas. And we can see in other fields, we can see this happening already. So there are specific providers for example, dentists, in veterinary medicine, but we haven't seen it in orthopedics yet.
So based on that, what would you say is your vision for the future, like the big picture that you want to paint?
So ideally, I want to build an AI copilot for all orthopedic doctors. So we are really the one solution that leverages everything that technology can offer to make doctors' work and their medical staff's work better, to help them, generate their revenue better, to drive down their cost, to make their job also more enjoyable, and to improve the care for their patients. But once we do that in one market, like in orthopedics, we could envisage doing that for other medical areas as well. I want doctors in the future, no matter in what medical area they work in, to be able to get the most out of the technology that is available to them.
That's a strong approach. If we move along like the storyline, what are the next steps for Author Copilot specifically in the next few months or years?
So this month we really want to polish up our MVP. Then we will kick off our clinical study in March that will run for 3 to 6 months. Hopefully we will have strong outcomes. We are quite confident that we will. And with those outcomes, we can go to commercial partners. We have, for example, 2 pilots confirmed with Ortivity, which is one of the largest orthopedic doctors chains in Germany. And once we have those 2 pilots done and we have good outcomes there as well, then we can go for fundraising, because then we have initial traction. We have the academic evidence that proves that this works. And once we have that, we can really build a product that we can start commercializing. And what's important is that we have a strong founders network, which means that we can do founder sales at the beginning, because we know many orthopedic doctor practices and clinical chains. And once sort of we have achieved that, that's when we can go for an even bigger round of fundraising and really start scaling the product and scaling the sales team.
Maybe can you share within all of that process a small story when your team came together to solve a specific problem that just came out?
Yeah. So there is one problem that we're still working on, but now we're making a lot of headway, which is the prediction of a diagnosis based on the anamnesis, right? So we have access to hundreds of thousands of old doctor's letters and the diagnosis. And what we want to say is, based on the answers you have given in your health questionnaire, can we already predict 2 or 3 likely diagnoses that you might have? This is a really hard problem to work on, because you're working with medical data, so you have GDPR and data security restrictions. It's very complicated because there are a lot of effects that influence each other as well. And we have to work on it locally. So when you say the team got together, we literally had to come together to solve this problem, because we couldn't work on it remotely. And the first couple of times that we tried this, we actually applied for TUM AI. I don't know if you are familiar with this program, but for the listeners who aren't, it's a program where you can apply at the Technical University of Munich, where you get 3 to 5 computer science and data science students together, and they solve a very specific challenge for you. We were part of those batches 3 times. So 3 times 3 months, where 3 to 5 students worked on it for 10 to 15 hours a week on that problem. And what we discovered is that the first batch we were completely unprepared. We had extremely talented technical students, but we had no one in our team to be able to guide them, because there was just an information gap between, my business and Marco's medical language and their technical language. The second and third batch went much better, because we had someone in the team that had studied medicine and computer science, and he was sort of able to translate a lot of the things that we wanted in both directions. That was one problem where the whole team had to come together, and now we have sort of a basic infrastructure that works, and we can start working on fine-tuning the models.
That's a strong approach as well. Like it helps to have different perspectives within the team. I just now realized again, because we're talking about the team, a diverse set of persons who have different skills and mindsets help for that language translation. Almost like you've mentioned that you were working with people from Indonesia who were coding. That's really a different language, but also from a medical to a computer scientist. is also a different language. So communication is probably really, really, really complex within the field of health AI.
Definitely, especially in healthcare, because you already have the medical experts that talk already their lingo, and then you have the technical experts on top that speak their lingo. So to get these two to really work together to build a product that makes sense from a care perspective is the first challenge. And then you bring in the business and regulatory component as well. So something that's also compliant with regulations, which is another lingo. And then is also successful as a business, which is the fourth lingo. So you have to basically bring 4 very different kinds of talking about the same issue together to get a digital health solution that is medically certified to fruition.
Yeah, and also there's and also there's a very different perspective that is important as well, right? The patient's view on the whole thing, right? How did you come up with a system that ensures that the patient is also within that loop, even though he's not like actively designing the software?
So the good thing is we have all been patients, so we have some personal experience, how it feels as a patient. I don't know how often you walked into a doctor's office and then you went out of it and you were like, damn, I should have asked this or that, right?
Yeah.
And typically you start Googling, and that's the worst idea you could have, because it's so hard to sift through trustful information.
Yeah.
But even if it's trustful, what does really apply to you? You don't have the medical knowledge to assess that. So the patient perspective is really important in everything we do. And that's why during the pilot, we also asked the patient perspective. And we will keep doing that.
Nice. I think a feedback loop like that is critical to develop a product that is closely aligned to both stakeholders in this case, like the doctors within the clinical area, the doctors that have their own offices, and the patients as well.
Well, also because if the doctors are our clients, the patients are their clients. So we have to understand sort of the end client as well, right? In any case.
That's true. So how do you see Ortho Copilot evolve? Like, from what I'm hearing of what you've been saying, it seems like you're building like an AI agent that is based on orthopedic areas.
Yeah.
And how does it evolve? Like, is the goal to have a fully comprehensive AI agent that takes like a real role within the medical industry?
It is. As a very first step, we need to sort of cover the basic digitization first, right? I think a lot of times in healthcare, when startups work on AI modules, they forget that the basic digital infrastructure in many cases is not there. So we basically have 2 systems. One we call the information capturing system and the data infrastructure system. And one is the insights generation system, which are both part of the same product. It's just a way of, thinking about the product. But it's not an actual differentiation in terms of product. The information capturing is really important because we want to make sure that we get as much information as possible in a structured and usable way. But also we want to make sure that we require minimum effort from the existing stakeholders to enter that information. So we can ask the patient to fill out a health questionnaire, but for example, we should make sure that a doctor can either send a voice note or generate a doctor's letter through just a few prompts, or be able to upload a doctor letter from a colleague and it will just capture the information through an OCR. So we just make sure that within that system, we capture a lot of information with minimum effort, especially because those stakeholders don't have much time. And this is the basis for actually generating insights. And the insights, there are different kinds of insights that we can provide. We can start with visualizing information in a way that is visually appealing and sensible so that the doctor can process it quickly and then be able to sort of make deductions from it. We can use it to make predictions. That's where the AI comes in, right? Based on the information that I have, what diagnosis can I predict? What treatment do I predict would be best suited for this patient? Or we can help improve processes. So this is sort of the second component. And in terms of time, we start at the very beginning of the patient journey, chronologically at the anamnesis. And over time, we will help develop tools and modules for diagnosis prediction, for appointment booking, for documentation, and then at the end also for treatment, and as a companion for the patient, also a health literacy chatbot where I can ask all my questions 24/7 without annoying the doctor with questions that a chatbot could also answer, which is fine-tuned to my personal case.
That's interesting. So you have like a real holistic approach on the project. What we've been talking about, that vision in the future, you have to know where you want to go. A different thing is, within all of that journey, what is something that you learned about yourself?
So from the top of my mind, there are two things. One is I discovered that I'm rather good at translating between different groups, whether it be medical, technical, and business, or whether it be, doctor, patient, medical staff. I always felt like this was clear to everyone, and then I discovered it isn't. So it wasn't something I was aware of, that it was a strength. It was something that was told to me from outside as a feedback, like, oh, can you please come in? You're good at getting an alignment between different groups. And I wasn't even aware that was a skill. But I'm glad to notice that it is. A limitation that I discovered, and something that I really need to work on, is I think I have many, many ideas. And maybe the listeners will think that, I generate a lot of ideas, but sometimes it's not really structured. And so I need someone that forces me to, focus on one thing at a time, because otherwise I think I also make our team members a bit crazy sometimes.
Collaboration is a huge thing, I think, in entrepreneurship. Like, everyone has different perspective on reality, on themselves, on the environment. And it really helps to get like a different mindset that helps you out on and get you grounded, for example, if you're flying too high in the idea space. And that synergy is more than the sum of its parts, right?
Right.
To really start to build something.
Someone said a really useful, to me personally useful sentence, which says, go more from your thought into your experience, which was, don't think about it, don't overthink things, but actually do it and get the experience. And that's something I think I could do better, but I think many other people could also do this better. I think this is an advice that applies to many, many people.
What piece of, or what piece of wisdom that you acquired through all of that could you bring to our listeners, to people who want to be an entrepreneur, who want to found an AI startup?
So for any startup, think about personally, what do you want to get out of it? And what does success feel like, right? So if you do a startup that should be VC funded, first of all, the chances that you will succeed are not really, really big, but it might be a great learning experience. I'm not saying that you should fund a startup as a learning experience. You definitely shouldn't do that. But think carefully about what kind of financing does make sense for my startup. Is it really VC, or is this maybe a startup that's not VC funded? And maybe it will be an SME. If I pursue a project and I have milestones in place, what milestones do I need to achieve for us to feel it like success? So for example, for the Copilot, the minimum thing we want to achieve is that this is a solution that will be a sustainable product that is used at the TUM Sport Orthopedics department and maybe a few practices. We would already have improved the lives of many people if we achieve that. But ideally, of course, we want to have a startup that scales and that becomes big and that, reaches a lot of customers. But I think it's important to have to not stop a project in the middle of it, to really assess, have I hit my own objectives? And if yes, I pursue it. And if not, maybe I have to stop and decide that I want to invest my time into something else. But also try to get it to a point where you feel like it's a close project for you. It's also important for your own story, right? If people ask you, so what did you work on? Maybe the startup wasn't successful, but you have a few milestones that you were able to achieve that feel good and that you can put on your portfolio and move on.
Nice. Thank you for that information. Actually, I think that helps a lot of people. I really think that's an interesting perspective on entrepreneurship as well, because you hear a lot when I'm in discussion with entrepreneurs. I hear a lot like, just do it, just go for it, start it. Don't really think like if it interests you, just keep on going. I think it's also important to give them your perspective that you just shared with us. Like, it can also be a structured process. Like, it doesn't have to be like all in like randomly, but like a more like an approach that has a lot of thought put into it.
Yeah, we call them proof points. We have usually we do 3 to 5 proof points into the future, so 12 to 24 months, and we say in 12 months when we hit proof point number 3, what do we have to achieve for us to say now we continue to proof point 4. And if we don't achieve that, we have to reflect carefully. It doesn't mean that you say, oh no, you didn't hit it, so you will stop now. But it means that you need to think carefully and you need to justify to yourself, why do you keep putting time into this? If you cannot justify it to yourself, how will you convince investors to basically justify putting money into your startup?
Of course. I think that structured approach, especially in health tech, is probably really a good idea, because it's a highly regulated field. You were talking about how doctors and how the space is from the cultural level, comes from the cultural level. So I think also you have to think about starting up from the perspective of your future customers and what they would like to see. Because maybe in arts, you can start up with less structure, but within medicine, someone would really appreciate it who meets you, that everything is thought through.
Yeah, correct.
Right.
Correct. Maybe to share, because with the listeners are mostly people that are thinking about going into the entrepreneurial space or not, maybe something that is helpful to them. We hear a lot about, the successes of a startup being, I don't know, 3%, 5%, 7%, whatever the number is, but it's low. I think that applies to startups, but it doesn't apply to founders. We shouldn't forget that many founders will do more than one startup. So the first startup might have a chance of, I don't know, 2%, but the third one you do, your chances will increase far more, because the chances of a third time founder are far higher than of a first time founder, obviously.
That's true. Like the chance increases drastically, actually, I think, because I don't really know a space where you learn more in such a short period of time as founding a startup.
I agree.
Because you have so much responsibility and you have to do everything on your own. There's no processes, there's no resources, there's no structured approach that someone gives to you. You have to think of all of it together with your team, of course.
Correct. Ideally, you also find mentors. I'm a bit careful with that piece of advice, because I think many mentors are not suited for the people that need their advice, right? So you cannot just take any mentor. It needs to be a mentor that fits, first of all, your phase in life, but also the project that you're doing. And maybe also you have a network of mentors. So in that case, I wouldn't talk about mentors, but I would talk about a network of experts that you rely on and that you are friendly or familiar with, that you can ask about different things depending on what your need is at the moment. I think, we see that with children, right? Children have thrive much better if they have a social network of family and friends that they can rely on for different topics. And I think the same is true when you start a startup. You need a network of people that you can rely on for advice, for different perspectives that will help you tremendously. And if it's only to not feel as alone as you would otherwise.
Someone to share the story, some inspirational stimuli. Yeah, I really think that's really important. The community aspect as well. I think you learn a lot from talking to other founders.
Correct.
To someone who's been in the same situation.
Yeah. Plus practical tips as well.
True. That's a really nice approach and ending, actually. Before we finish up the podcast, we have an interesting project with you. It's called rapid fire. I'm going to ask you some quick questions and you answer them as fast as you can. Are you up for that?
Shoot, I'll shoot back.
Yeah, nice. All right. Ortho Copilot in just one word.
Ortho Copilot.
Which historical innovator or entrepreneur would you most like to have dinner with?
Steve Jobs.
What is your go-to strategy for resetting or finding inspiration outside of work?
Friends and family.
What piece of tech besides AI you can't live without?
My washing machine.
Which fictional character do you wish you could hire for your startup?
Daniel Düsentrieb. For all those who don't know, Daniel Düsentrieb is the inventor in Donald Duck.
Yeah, nice. That's a very cool and interesting fact to end our podcast. Thank you for listening to all the listeners and watchers out there. It was a lot of fun, and thank you for meeting you. Thank you for all of your insights. And I really hope that like your vision and what you do with Ortho Copilot comes to life. And I wish you best of the luck for the POC, for the clinical study. I hope it really helps you to reach your goals.
Thank you for the wonderful conversation.
Thank you.